Well, hello, my name is Holly Foxworth, and I am a registered nurse. I'm also the marketing manager here at Axiom for content. And so I wanted to jump on real quick and kind of speak with Dr. Cherry, get his thoughts about some of the recent uptick that we've seen in COVID cases, and talk through that. Maybe just kind of talk us through what we're seeing, what maybe some changes that could be occurring, and then talking through some of the discussion about the mask mandates, whether we think that'll be the recommendation or whether it will actually become a mandate in and of itself. And then obviously what would be a perspective that employers may want to take note of and really focus on. So Dr. Cherry, thanks for joining us today. I appreciate it.
Yeah, thanks for having me. I look forward to discussing this.
Yeah, for sure. Real quick, so can you talk to us then about why we're seeing, it seems like that obviously there's a little bit of a downside in interest, obviously, about COVID. I think everybody kind of feels like that maybe it was gone, but that is not the case. And it looks like that we're seeing that uptick in cases. Is that what you're seeing as well from your side, Dr. Cherry?
Correct. With Omicron hitting so massively, that really was the biggest surge we had ever seen. I think we were having up to maybe almost 800,000 cases to 1 million cases per day in the US. So now that we've really cycled and trended way down from there, I think people are happy to see, kind of COVID at least really reducing in a main way. But what we've been noticing over the last 4 or 5 weeks is, although the average case count for the U.S. has come down to about 25,000 per day, over the last 4 or 5 weeks, we've actually seen it kind of pop up to about 50 to 60,000 cases per day, and so that's kind of meaningful in many ways. So it's kind of doubled from, again, 4 or 5 weeks ago, and what we've learned about COVID and Omicron specifically was a large proportion of the US was infected by Omicron. And there's been some studies now that look at the what's the rate of reinfection with Omicron. And so previous to Omicron, reinfection rates were thought to be, between 1% and 4%. So that meant for every 100 people that were infected with COVID, 4 would be reinfected. The reinfection rate for Omicron is about double that. It's about 7 to 8%. And so, that does mean that we're going to see more and more people get reinfected. But because so many people were infected, and still over 90% of people who've been infected do have fairly good immunity, that population at risk is much smaller than it was before. So when we see a spike, a doubling of cases in such a short period of time, that kind of gives me a warning sign to say, COVID may be trending back more aggressively than we would have thought, but under the shadow of the Omicron surge previous, and now with this smaller population at risk, the signal's a little bit smaller, but in many ways, seeing this doubling or so is a little bit concerning. And also, I know a lot of the U.S. is not testing like they used to, so the signal is further reduced. So there's a bunch of things going on that, may not have us pay attention to what's actually going on, or it may actually mute the signal that's happening right now.
Yeah, definitely. So one thing I was going to ask you about that, though, is this issue of, how long that immunity is valid for. So there's been some discussion about whether that should be extended, whether 90 days, whether that's correct anymore, whether we should be looking at what a booster would provide for additional protection there. What are your thoughts?
Mm-hmm. So I think the studies on boosters have not been as promising as the original series, and we've been seeing now data that shows, after maybe even just half, after 6 months or so, the protection from the original series or the booster, especially to Omicron, is quite low. And so vaccine efficacy may drop, or, in the real world, vaccine effectiveness may drop down below 50%, below 25%. So that is concerning. And so there has been this discussion about, is natural immunity also something that is going to be an important driver. And so we are seeing people who are vaccinated and then become infected. And then again, that reinfection rate of up to 8% right now. So, and that's a blend of unvaccinated and vaccinated people.
Gotcha.
So again, the vaccines are probably not the complete answer, but that's what we've been kind of discussing on this kind of webinar series, is having
Yeah.
kind of this multi-layered approach.
Yeah, I like it. Yeah. So the other thing I was going to ask you about was the symptoms and mortality rates. Are we seeing now that, though, have you noticed that there's any others that are having additional symptoms, that they're either more severe, less severe? The mortality rates, are we seeing any increases there, or things remaining pretty steady?
So with Omicron, there was definitely a shift in the symptoms, but the symptoms have always been non-specific in Omicron or in COVID in general. So COVID is really not a disease that you can diagnose based on conditions, because it's potentially flu-like. When you had loss of taste and smell, that kind of was a helpful indicator, because not many infectious diseases cause that. But it's really a challenge. Not many people think they have it, then they get a positive test, and vice versa. You think you may have it. When you think you have it, then you don't. And so it's quite challenging across that way. But something that's a little bit more objective is mortality data. So although Omicron was so much more infectious and contagious, fortunately, it was less, the mortality rate was much less. However, there was still significant deaths with Omicron, just because of the huge number of cases in general. And so that is a tough one to see. But if Omicron had the fatality rate that Delta did, I mean, the death rates would be way higher.
Right. Yeah. Okay. Well, the other one was, I was wondering about the mask mandate. This has been a lot of discussion this last week. We've seen a lot that was in the media and everywhere else. It looked like that the recommendations were going away, and then now we see that the CDC is saying, they're recommending that they be reinstated, and this would be specific to public transportation. What are your thoughts there?
Yeah, I think, early on, a couple of years ago, there wasn't great kind of a foundation of evidence to do one thing or the other. But, moving forward with a mask recommendation and mandate was the course. And, I think there's some things that can be addressed for each person or for each organization listening that will help them make the best choice for themselves, regardless of if there's a mandate. So, there was cloth masks allowed in the beginning. In fact, those were the ones promoted that you made your own. And so I think now it's pretty clear that cloth face masks do not really help at all. And that the surgical masks do have, some benefit. But if someone, or if a organization really wants to have a large protected factor, really an N95 is going to be the tool that you can approach, that has high levels of protection. And so everyone has it, kind of has a choice here in many ways, and in each organization too. But again, if you're looking for kind of a high reliability and a high protection factor, it's quite clear that's where you need to go. I know before there was a concern about supplies for healthcare workers, so that may have been part of the messaging to wear a cloth face mask. So I think now, with a couple of studies that have come out showing, again, cloth face masks don't really have any evidence of protective effect, then you would really need to shift to like a surgical mask, which only has kind of incremental as well. So it depends on your goals as an individual or as an organization. And so if you're traveling, regardless of if the government is imposing a mask mandate or not, if you are concerned about yourself in a closed space with the public, again, that N95 is probably going to be the tool that's going to give you the highest level of protection. And as long as supplies are out there for healthcare workers as well, I think then it's an easier choice.
Right. Yeah, definitely have some additional values, additional benefits there whenever you're using that versus the cloth. Well, so to wrap up here, then tell us what employers need to know. We are seeing an uptick in travel now. Groups are traveling to different business meetings. We're seeing, in fact, ourselves, we're going to our first trade show that we've been to in years. This next week we'll be at the National Safety Council there in New Orleans. What are your recommendations for employers that are going to have people that may be traveling and may be out and going to different locations?
So in general, I would say try to maintain as many of the layers of protection that you had during the peak surges, kind of indefinitely, or at least in this short to medium term. Each one that you allow to relax, there's not one perfect layer of protection, but if you can have this culture of health where people do not come into work sick, do not travel when they're sick, I think that would make a huge difference. And if collectively our society did that as employer populations, but also just society, the unemployed populations as well, that would go far. Again, if an individual or an organization wants high reliability about safety, then using those higher actually filtering face piece, those N95s are much better than surgical masks. Again, maximizing people's own personal health, where before COVID, there was corporate wellness programs that looked at each individual's health to maximize productivity. And so if you can optimize your health as well, you will be more resilient to COVID on average. And so that's a big deal. And it may change the return on investment aspect of corporate wellness programs compared to just personal wellness with everyone on their own. And, also supporting those with vaccinations and, the other component, which is, I think, a component of wellness, but, having a lot of the things that we kind of were brought up by our families, and, mom would always say, go to bed early, exercise, eat right. Like all those things actually make a huge difference in every aspect of our lives.
You're exactly right. Wonderful. Any additional tips or any other information that I didn't ask you that you want to share?
I think part of this was, we wanted to kind of have everyone not provide fear, but just kind of remind folks to not be overly complacent and to be aware just in case something changes. Because right now we are seeing this signal that is kind of it's a fairly robust signal based on all the limitations that we discussed at the beginning of this kind of quick messaging. So, but that's all really. I really appreciate everyone's attention.
Yeah, for sure. All right. Well, thank you so much. I thank you guys for joining us. Obviously, we'll put out some additional content information in print. We'll send that to you. And you're always welcome to get that from our website as well. Well, we look forward then to seeing you again I think we've got a webinar, not this next week, but the week after with you, Dr. Cherry. So I look forward to seeing you then.
Thanks. Me too.